My fellow Jamaicans, for over 2 years, the Ministry of Health has been preparing for the introduction of the chikungunya or chickpea in Jamaica. With the introduction of the disease into the Caribbean since December 2013, we have heightened our preparation and activated our response over the past few months. Now, like most of our Caribbean neighbors, the country is experiencing increasing numbers of cases. This is expected as the entire population has never been exposed to this new virus, and everyone is susceptible. This trend is normal for any new disease introduced into a country and is similar to what is being experienced in other Caribbean countries. As a citizen of this country and the Minister of Health, I assure you that the ministry will continue to do all it can to address the issue. I want to express my sympathies to those who have been ill and wish you a quick and full recovery. While I understand the concern and anxiety of Jamaicans to this new illness, I'm worried that important messages are being lost in the sea of misinformation that has been circulating. I therefore want to highlight a few important points. 1, chickpea is spread by the bite of an infected Aedes aegypti mosquito. 2, Aedes aegypti is a container-breeding mosquito found in and around our homes and other places where people gather, such as schools, businesses, and places of worship. Any container in which water settles can therefore be a breeding site. 3, gullies, drains, canals, or other waterways are not the preferred breeding places for this mosquito. 4, the symptoms of chickpea range from mild to severe, and in some cases may be resolved in only 2 to 3 days. However, there are rare cases involving persons, especially in the high-risk group, who experience more severe symptoms and may even have difficulty moving. 5, there is no specific cure for chickpea or a vaccine to prevent it. Persons are treated based on their symptoms and are urged to take painkillers such as Panadol, Cetamol, and Tylenol. Drink lots of fluids and get enough rest. 6, chickpea is new to the country and each individual is at risk. I want to assure you that we have been working assiduously to implement the planned activities, including vector control, community fever surveillance, and public education. Since June, we have initiated a number of response measures. Activities to identify and destroy breeding sites were conducted in over 484 communities, with some 50,887 premises inspected. 84,015 containers were inspected for mosquito breeding. 24,206 containers were treated. Fogging was carried out in 977 communities. Active search for cases in communities involved over 15,000 532 persons. We have done direct, face-to-face public and community education with some 60,000 persons, and our activities continue on a daily basis. The ministry notes that based on information from communities and private physicians, there are a number of cases involving persons with fever, joint pain, and rash in excess of what has been officially reported to us and which would not form part of the official numbers. We continue to investigate as we have an interest to determine all the types of viruses that are presently circulating. It is important to note that the expectations is for CHIKV cases to spike and then trend down as persons begin to build immunity to this new disease. You can only get CHIKV once. We are aware of the impact this is having on productivity and attendance at school and work, and ask employers to be compassionate and assist their staff through this difficult period. We expect that the health workforce will also be impacted, and so we are putting in place an emergency response plan to ensure that we can continue to provide care to the population. Be reminded that dengue is also spread by the Aedes aegypti mosquito and is more serious than CHIKV, as the death rate is much higher. Deaths from CHIKV are very rare and usually occur in persons with other illnesses, especially chronic illnesses. The death rate from CHIKV is less than 1% compared to dengue, which is 1 to 5%, and influenza, which kills millions each year. In 2012, we had a total of 5,929 suspected dengue cases, and in 2013, we had 925 cases. I want to appeal to persons in the high-risk group, including pregnant women, infants, children under 5 years old, and persons with chronic illnesses such as diabetes, hypertension, and cardiovascular disease, to seek medical care immediately if they experience symptoms that could be CHIKV. For us to control the spread of dengue and chikungunya, the Ministry of Health cannot work alone. It needs a comprehensive and integrated response, with all of us playing our part. That is why I'm meeting with stakeholders to establish how we can continue to work together going forward. One such meeting was held on Thursday, September 25th, 2014, and involved mayors, local government, transport and works, tourism, and the Water, Land, Environment, and Climate Change ministries, the National Solid Waste Management Authority, the National Water Commission, and others, as we put plans in place for a national cleanup effort. I want to make the point that this is not the first set of stakeholder meetings that we have had. Even before we had the first case, we began to engage stakeholders, including the Ministry of Education, to assist with the response. While the government must lead the process, citizens have a major role to play in the reduction of the spread of this disease. It is therefore important for all of us to ensure that we are not harboring this mosquito in our homes. Personal responsibility is going to be of utmost importance in the reduction of the spread of this disease. Starting today, I urge you to take at least 10 minutes each week and look around your home, your school, your workplace, your church, and ensure that there is no uncovered container with water that could breed mosquitoes. Check your flower pot saucers, your dish drain boards, your refrigerator troughs, plants, pet feeding bowls. Scrub them clean to get rid of the mosquito eggs and punch holes in tin cans. I implore every citizen to join us when we declare a National Cleanup Day. Let us take charge of our health and restore national pride. Let's make Jamaica the country where we all want to live, work, raise families, and do business. May God continue to bless Jamaica.